right. Okay.
Okay, my name is Jill Gray. This is my persuasive speech. After my presentation, I'm sure you will see the clear value and benefits to breastfeeding newborns and infants. Also that the education of breastfeeding makes mothers more successful. We are all excited to hear the news of joyful parents announce their baby to the world. There is so much pressure and so many changes to take on this new exciting challenge. Where will your baby be born? At a hospital or at home? Where will your baby sleep? In a crib or a bassinet near you? Will one of the parents stay home to care for the infant, or will you need to find a sitter or a daycare? There's a big decision new moms might not think that much about: the choice to breastfeed or use formula. If more hospitals use tools to present breastfeeding as an important step for the well-being of their newborns, the numbers of breastfed infants would be on the rise. If mothers knew the amazing benefits that breast milk provide, maybe more mothers would use less formula. Some hospitals don't even speak with the mother about her preference of breastfeeding or formula. Some women have said that the hospital has given their newborn a bottle of formula against their wishes because they were sleeping and they didn't want to wake them. This needs to end, and we need to educate the importance of breastfeeding. The American Academy of Pediatrics and the World Health Organization say that breastfeeding is really best for babies. It helps against many things. It can help defend against infections, prevent allergies, less cases of diarrhea for your newborn, less ear infections. It can even improve brain growth and protect against chronic infections. Other breastfeeding facts that are interesting is breast milk is always the right temperature, so there's no heating it up or having to use a bottle if you choose to. Breast milk changes based on the age of the child, so the nutrition also changes, providing what's needed when the child is a certain age. There's no cost to provide it to your infant or child, so that helps you save money. And breast milk banks are available to moms who are unable to breastfeed. And still, some breast milk is better than none, so even if you only did it for a short amount of time, your baby still benefits from it. The American Academy of Pediatrics says babies should exclusively breastfeed for the first 6 months and should breastfeed till at least the age of 12 months or longer if the child and the mother are willing. Hospitals can help promote breastfeeding. UNICEF and World Health Organization encourage hospitals to promote breastfeeding. They started doing this in the early 1990s. Before that, it was really not pushed. For a hospital to receive a baby-friendly status, they need to practice something called rooming in, and that's when the baby always stays in the room with the mother. There's no nursery time, and that helps really promote breastfeeding and the bonding. The babies always receive breast milk unless medically necessary, and there's no pacifiers within the first couple of weeks to help prevent nipple confusion. Dr. Michael Kramer said that these aren't the only steps needed. According to Kramer, the following guidelines are crucial. Make sure the baby is swallowing milk. When babies are very newborns, you can hear them swallowing when they're drinking the right amount of milk. Otherwise, they could just be getting air or nursing, suckling. Teach the baby feed on demand and not a schedule, and provide support for mothers who encounter problems. I was lucky enough to have many of these practices in place at the hospital where my daughter was born. I was asked before the birth of my daughter if I wanted to breastfeed, and my answer was yes. After her birth, her bassinet had a sign that said breastfed on it, and it also said no pacifier. Those are really important, so if any of the new nurses came in, they knew that she was breastfeeding and not using formula. It's also important that your baby stays with you, and my daughter stayed with me the entire time I was at the hospital. My birth care nurse also promoted skin-to-skin contact as soon as she was born, and that really helps promote with bonding, and that also aids in the breastfeeding. The first latch should be as soon as possible to help stimulate milk production. I had the support of my nurses and specialized lactation consultants to address any issues I had while in the hospital as well as when I came home. I left the hospital with a chart of detailed instructions that measure the amount of milk intake and diaper output. This is to make sure that your infant is receiving the right amount of breast milk. When they're breastfed, you can't really measure it like you can with formula, and so this chart helps make sure that they're drinking in the right amount. Newborns need to have at least 6 to 8 wet diapers, and if they're doing that daily, that's a good sign that they're getting enough breast milk. After the first month, when you have a doctor checkup, if your baby is gaining weight properly, you don't need the chart anymore. Most importantly, I had the support of my husband. Dads can play an active role in breastfeeding by giving support. They can get up with the baby. My husband, for the first couple of weeks, changed every diaper because I was breastfeeding every 1 to 2 hours and exhausted, and that seemed to really help. That also helps dads form a bond with infants if they're breastfed, because they're spending a lot of time nursing, so the dads don't get as much time with them. The other thing that the doctor said was really important is for dads to learn to offer help, even if the mom doesn't ask. The first few weeks can be very challenging, and it's important that moms have all the support they need. There are tools to help new mothers with questions and support for breastfeeding. The Leash League website, they also have a 1-800 number. You can call them at any time. They'll send you information, and they have nursing consultants to help you. You have your local hospital. Mercy has quite a few options. They have a breastfeeding education, a lactation consultant. They're always available 7 days a week. You can have your own personal consultant. They have prenatal breastfeeding classes, and they'll do office and home visits. St. Luke's offers lactation consultants as well. They have breastfeeding courses, educational aids, prenatal assessments for moms who have previous anticipated breastfeeding problems, and if you have any other needs, they can also come to your home and office. I had my nurse came and checked on me in a weekly visit for the first couple of weeks to make sure that everything was going well and answered any questions that I had and made sure the latch was correct. I feel like that was really good support. You can also have support groups. There's, you can use online, there's a Nursing Mothers Council, you can use Facebook, and there are other forums for nursing mothers. Breastfeeding may be natural, but for many new moms it doesn't come naturally. It can be very difficult, and there are products to help ease any problems you have while you're breastfeeding. There are nipple shields, lanolin for healing sore nipples, there's a boppy. It's a pillow that helps support the baby, and it kind of really helps take the load off your back and your arms. And there's breast pumps that allow the mom to go back to work and still be able to breastfeed. With these tools and proper support, structure, and education of new moms and hospital staff, rates of mom deciding to breastfeed can increase. Right now, according to the Surgeon General, 64% of mothers breastfeed their infant for the first few weeks, which is a lot better than a decade ago when it was only 50%. When new mothers and fathers learn the importance that breast milk offers, such as less illness, preventing allergies, protecting against chronic infections, more moms will at least try to breastfeed. We need to make breastfeeding a subject that's okay to talk about, allow women the time and privacy at work, and normalize breastfeeding in our society. If we do, we will soon have more children who are breastfed and allow our society to accept breastfeeding as the best option for infant nutrition. Thank you. It's really dry.